So, Keir Starmer's sycophantic carbon copy, the Shadow Health Secretary Wes Streeting, has proudly announced that Labour would use private health providers to cut NHS waiting lists. Having stood to end privatisation on a health service, Keith has lied again. So not only is the NHS not safe in Tory hands, but now it isn't safe in Labour's hands either. So far to the right have they swung. He reckons it worked so well under New Labour, we should do it again. No, it didn't, Wesley. Honestly, there must be a tree somewhere on this planet entirely dedicated to replacing the oxygen you waste on a daily goddamn basis. New Labour introduced a private market to the NHS, the gleeful hand-rubbing of Blair's billionaire buddies as they priced up slices of the pie. As bad as the Tories have been with the NHS, they built on what New Labour started. Keir Starmer literally said in 2020 that private healthcare was a disgrace and that public assets should be in public hands. But of course it was a lie. He and Screeching must have been cattle farmers in a previous life, never mind lawyers or toolmakers, for the sheer amount of bullshit they shovel at us and expect us to believe. Blairite handling of the NHS left it with crippling debts and the beginnings of the most profitable areas of NHS provision sold off. Starmer and co would now say they could continue with that, saying privatisation works. It has never worked. Aside from the NHS, look at mail, rail, look at the energy crisis we're facing, water bills, telecoms, and tell me paying more for a shittier service so that shareholders can get rich off of it is working for you. It has never and will never work except for an elite few, and you truly have to be an idiot to look at PFIs and think, oh, yes, please, let's have some more of that. It comes at a cost, he admitted. The trouble is that cost lines rich people's pockets. It does nothing to restore provision to our health service, does nothing to recruit staff, does nothing to retain staff, does nothing to train or provide for staff. In fact, we lose more NHS staff to private healthcare. Since 2010, when the Tories took over, private sector involvement in the NHS is up 93%. They've thrown over £113 billion at non-NHS providers. Those waiting lists Screeching thinks will get brought down are up 200% now since 2010. He is completely and utterly wrong and would throw more good money after bad whilst the health service continues to fail. We need new government, sure, but no way in hell would Labour under this leadership be that. Our health service is being betrayed utterly by them right now, and Knight Bevan must be spinning in his grave.